Well, good evening, everyone. Are we having fun? Excellent. You know, it truly is an honor to be able to be here with you tonight to celebrate 100 years and your annual general meeting of the Registered Nurses Association of Ontario. Can I say you've come a long way? Yay. What an amazing milestone. That is 100 years of advocating for and supporting a strong nursing workforce, helping nurses expand their skills and competencies, advancing better clinical outcomes, and having an immeasurable impact on our healthcare system. On behalf of Premier Ford and our entire government, I want to thank Doris and all of you at the RNAO for everything you continue to do to support building a stronger, patient-focused healthcare system. I'd also like to express my sincere appreciation and gratitude for Ontario nurses past, present, and future. In our hospitals, in our clinics, in our long-term care homes, and throughout our communities, Ontarians know they can depend on nurses to provide expert, compassionate care at every stage of life. You are a pillar of our healthcare system and in our communities, ensuring patients and families are provided with exceptional care and support when they need it most. And we are grateful for your extraordinary dedication and your professionalism each and every day. Under the leadership of Premier Ford, our government has been making record investments in our healthcare system. We're taking bold and innovative action to make it faster and easier for people and families to connect to care closer to home, including by investing in, growing, and providing strong support for Ontario's nurses and other healthcare professionals. More nurses are joining our healthcare system, with nearly 100,000 additional nurses registered to work in Ontario since 2018, and 30,000 nursing students currently studying at Ontario colleges and universities. Our government has been making significant investments to expand nursing education, increasing enrollment at universities and colleges by 2,000 registered nurses, 1,000 registered practical nurses, and 150 nurse practitioner seats. With these investments, 8,000 additional nurses will join our healthcare workforce by 2028. Those are all new members, Doris. And we are launching the first new nursing program in 20 years at Carleton University to continue growing our nursing workforce for years to come. You know, I have to say there's been a lot of work done here, and this does not happen without the incredible leadership and work of Dr. Karima Valji and your small but mighty team, so thank you. Through our work with the College of Nurses of Ontario, internationally educated nurses can, as of April of this year, move through the CNO registration process faster, allowing them to start practicing in Ontario and caring for patients sooner. We're also consulting on automatically recognizing other provincial and territorial certificate of registrations as a valid Ontario certificate of registration when the clinician is practicing in Ontario, beginning with nurses and physicians. And we are consulting on removing current practice setting restrictions in our as-of-right registration, and expanding these rules to include American licensed nurses and physicians who are looking to live and work in Ontario, because there is no doubt that people want to be in Canada and in Ontario right now. Our government is increasing opportunities for nurses to access more specialized training and optimize their expertise and scopes of practice. With RN prescribing, we are enabling registered nurses who have completed additional education to prescribe drugs for certain conditions. This, since expanding the roles of registered nurses to prescribe medications, 671 registered nurses have already completed the training and are now authorized to prescribe. Our government has also been focused on supporting nursing recruitment and retention through the Community Commitment Program for Nurses, which provides an incentive of $25,000 over 2 years for new nurses or nurses returning to practice, in exchange for a 2-year commitment to work in a higher needs part of our province. Through the Clinical Scholar Program, experienced frontline nurses are hired to provide mentorship and support to new graduates, internationally educated nurses, externs, and nursing students in hospitals across Ontario. And I must say, as I visit hospitals across Ontario, the extern program has been very well received and is really working well. We are funding the RNAO as it continues to implement the Nursing Education Initiative, which includes the Best Practice Spotlight Organization Program that helps advance better evidence-based healthcare in Ontario. We are, absolutely. That's RNAO leading Ontario and Canada. You should be proud of that. We are also ensuring better access to care through accelerated investments in home and community care, which are stabilizing expanded services and increasing compensation for nurses, personal support workers, and other frontline providers. And through our historic investment in primary care, our government is creating and expanding 305 additional primary care teams, connecting 2 million more people to publicly funded primary care by 2029. This includes up to 80 new and expanded teams this year that will connect 300,000 more people to a primary care team this year. This also includes supporting new and expanded nurse practitioner-led clinics, which builds on the invaluable publicly funded care already being delivered by dozens of existing nurse practitioner-led clinics across Ontario. We've seen it work and we want to expand it. As part of the 2025 Ontario budget, our government is investing up to $300 million to build up to 17 new and expanded community-based primary care teaching clinics in communities with high rates of unattachment to primary care. These clinics will, of course, train doctors, but also nurse practitioners and other health clinicians, such as registered nurses and physician assistants. We are finally training people together as a team because that's how we know they like to practice. We're also combining direct patient care with hands-on learning, allowing approximately 300,000 additional Ontarians to be connected to primary care. Ontario's dedicated nurses and the collaboration and contribution of key health partners, such as the RNAO, are critical to the ongoing efforts to ensure people and families in Ontario have access to high-quality, connected, and patient-focused care when they need it. Thank you again, Doris, Amo, and the entire board and team at RNAO. Here's to the next 100 years in leadership and excellence in nursing in Ontario. Before I go, I would like to invite Doris to join me on the stage. You don't need to know everything, Doris. Stay there. Oh, your turn. Everyone in this room knows that Doris Greenspun has been a true champion for Ontario's publicly funded healthcare system and world-class nursing workforce. And I want to thank you for your efforts to deliver more connected and convenient care for your service to the people of Ontario. That is why it is my honor tonight, on behalf of Premier Ford, to present to you your King Charles III Coronation Medal in recognition of your service. Stay well, everyone.